On February 5, 2011, North Carolina's mental health care workers organized a public hearing in Goldsboro, North Carolina to highlight abusive working conditions at North Carolina's mental health facilities. North Carolina Public Workers Union UE 150 and North Carolina NAACP co-hosted this public hearing. This public hearing highlighted mental health workers' demands to pass a legislative bill for a mental health workers' Bill of Rights, stop attacks on public workers, tax the wealthy and the corporations, collective bargaining rights now. Saladin Muhammad, founding member of Black Workers for Justice and coordinator of the International Workers' Justice Campaign, informed the public of the context of the mental health workers' struggle.
The conditions faced by mental health workers and all public sector workers in varying degrees are directly related to state policies of banning the right of public sector workers to collective bargaining. When state governments deny the right by law, it sends a message to all state administrators that they don't have to listen to or act on the issues raised by the workers. This affects the quality of delivery of public services, especially those who are providing health care to other human beings. This violation has been deemed a violation of sections of the Universal Declaration of Human Rights, which all countries are expected to abide by.
North Carolina public health workers have demanded a mental health workers' Bill of Rights that will ensure basic rights for workers, which includes family supporting wages, safe working conditions, fair grievance process, and fundamental right of workers to collective bargaining.
We need a mental health workers' Bill of Rights that strengthens our ability as workers to provide quality care and to protect ourselves from the abuses stemming from the lack of enforceable worker rights and the attacks that are occurring on the public sector. The testimonies that you will hear this evening will bear witness to the problems and the issues facing mental health workers throughout the state on the negative impacts of what I call a failed and flawed state reform system.
To the panel and everybody up here, and everybody in the building, state workers have made sacrifices for the state of North Carolina as long as I've been working for the state. I've been working for the state 25 years. We have tolerated pay cuts and furloughs and still tried to raise families and couldn't. Now with the Dick's closing and Dick's employees having to go to CHR work, we can't afford to take care of our families.
According to the Mental Health Workers' Bill of Rights, this violates the following: the right to family-supporting wages so that mental health care workers can devote their time to the care of their patients and not have to take on a second job.
In 2005, I was unjustly transferred because I protested unsafe staffing on my unit, which was directly related to the inexperience of the newly appointed manager. When I won the first grievance and was returned to my building, it angered nursing administration so much that they quickly fabricated false allegations against me and transferred me again. It took 1.5 years and $28,000 to go through the grievance process again. I am the first nurse in North Carolina to ever win a whistleblower case against the state. The written warning remains in my files as the on-campus hearing was a sham. It was conducted according to regular courtroom procedure, which no employee would know unless they were a lawyer. For example, I was not allowed to question the person that put the written warning in my file because I did not list her as a witness. No instructions were provided to me that would allow me to know this. The lawyer hearing officer conducting the hearing would not allow me to have a copy of the audio tapes, although I learned later that they were instructed to do so. The lawyer and hearing officer decided in favor of management as she stated that the policy was not a good one.
According to the Mental Health Workers' Bill of Rights, this violates the following: the right to adequate staffing levels, the right to a grievance procedure, which includes the right to grieve all matters that can impact safety, evaluations, raises, transfers, and promotions, with representation of one's choice at all levels.
Grievance procedure, the investigating poet. First of all, when you go in the investigating part, it's like you by yourself and 3 other people. So if you ask for someone to come in with you, it's 4 people because everybody's for casual. The next thing they give you is you ask for information to defend yourself. They tell you they can't give it to you to the 3rd step.
I was hired as a secretary, processing assistant 3, for the director of nutritional services. I am her 5th secretary, and she has been there since 2003, guys. I have had a book thrown at me. I have been called ignorant, stupid, many more times than anybody can count.
According to the Mental Health Workers' Bill of Rights, this violates the following: the right to be treated with respect and dignity regardless of job classification, the right to grievance procedure.
My paperwork, getting ready to do my 30-minute check, and all of a sudden I would just punch her in the face, which you see the result of the thing. My face, had broken facial bone, fractured my nose, a fracture. My glass were also broken, and I shouldn't make all the workers just so slow. I guess they were scared, He shouldn't got but 1 blow, I had, I got 4 or 5 blows, and I feel like, it shouldn't happen. I feel like it shouldn't never happen.
According to the Mental Health Workers' Bill of Rights, this violates the following: the right to a safe workplace, including protecting oneself from harm with consideration for the safety of the patients. These and many other workers' testimonies highlighted a widespread abuse of the rights of mental health care workers, ranging from the right to a timely briefing about the behaviors of patients that workers are assigned to care for, the right to adequate and updated equipment and techniques, the right to refuse excessive overtime. Workers' testimonies were followed by observations and recommendations by panelists.
It's pretty clear that we've got to frame this discussion, Senator Berger, in the General Assembly about the impact of budget cuts and forcing these institutions, which have always been poorly managed. They've never been managed well. But in this time, we've got to translate the conversation to what the budget cuts are forcing in these environments.
There seems to be a disproportionate negative impact on African Americans. And because these are state agencies involved in this, and because the U.S. government has signed and ratified an international convention to eliminate all forms of racial discrimination, it means that the government has a responsibility to ensure that none of its practices and policies are violating the rights of people on the basis of race.
If workers are not treated and acknowledged for the value of their service, then they feel disenfranchised. They no longer work harder because they're not valued. So we have to, and sadly, the main way that we identify how we value people is what we pay them to do the job. We also know that workers who are not properly trained are going to make mistakes. Training includes certain things. It includes knowing who you're dealing with before you get in that situation.
I don't believe there's a single person in this room, or workers, either in this room or work for the industry, that were part of drafting those grievance procedure. This is what we do in a union. We sit down and develop a grievance procedure.
That's right.
We have a voice at the table. And at the end of the day, it is our grievance procedure. And that we know what those procedures are up front in a union contract.
To fight for North Carolina public workers' rights, a coalition of labor and civil rights organizations has been established.
How we treat the most vulnerable among us and how we care for those who treat the most vulnerable among us is a moral question, is an economic question, is a labor question, and is a question of civil rights. And that's why this coalition is so important. And that is why there can never be a separation between labor and civil rights.
We want economic justice, workers' rights, and a budget that's not balanced on the backs of the poor. Governor, we want you to veto everything that's wrong and stand up.
North Carolina.
For many years we worked as slaves, sun up, sundown, and even Sunday. Then this wealthy nation took the work from us. You know you're wrong. For services rendered